All right, welcome everyone. Good afternoon. Thank you so much for joining us today for this Credentialing Discovery series. My name is Hannah Stewart-Lathan, and I'm the Director of Experiential Learning and Career Services at CUNY SPH. And I'm very pleased to be joined by some wonderful colleagues today, both at the school and externally. If you are here to learn more about the certification in public health. I am joined today by Dr. Susan Klitzman, who is our Senior Associate Dean for Administration at CUNY SPH, Allison Foster, who is the President of the National Board of Public Health Examiners, which administers the CPH exam. We also are pleased to have with us Lesnar Guerrier, who is an NPH alumni at CUNY SPH and is a new CPH holder. He took the exam in November and we'll be speaking with you about that today. He is also the director at Bayview Community Center in Canarsie in New York City. And then finally, we have Tina Lynn with us today, who is our student career advisor, who I know many of you have met with and know, and it's a pleasure for all of us to support you today in this Discovery Series session. So with all that said, we'll begin by hearing from Dr. Klitzman about her experience with also being a CPH holder and the benefits of that credential.
Thank you, Hannah, and it's great to see everybody. Happy spring. I'm so happy to be here. I just want to take a few minutes to talk about my experiences with the exam and why I think it's important for people to get certified in public health. And then unfortunately, I have to jump off for another meeting, but I'm happy if anybody has questions to contact me directly or through Hannah or Tina or Maya, and I will be very happy to answer your questions. So my story is that I took the CPH exam the first time it was offered in 2008 and have maintained my certification ever since for 15 years. And the reason I took it was because at that time I was a faculty member in public health at CUNY, and I was getting a lot of questions from students about the exam. Should I take it? How hard is it? Do I need to study? So I decided that the best way I could answer their questions was to take the exam myself. So I did study, and there are all sorts of guides available, study guides, sample questions, practice tests, which you'll hear about. And I do recommend that anyone who wants to take the exam do study, because it covers a wide range of topics and no one knows everything. The test itself, the questions were very varied. Some were very easy. A few of them referred to articles that were published after I graduated public health school. I didn't read, so I didn't get everything right, but I did pass the first time. Why should a person take the exam? Well, on a personal level, as you'll hear, that more and more jobs, especially government jobs, give preference to people who have the CPH credential. And it's also, I think, a very good way to formalize a commitment to lifelong learning, which is, of course, a core value in public health. As you can see, public health issues are always changing. Knowledge is always changing. Just look at how much has changed in the past 3 years in the brief history of the COVID pandemic. In the beginning, there were no tests, no treatment, no vaccine, and look at where we are now. So to be a public health professional, you have to keep up with the latest knowledge, and taking the exam and recertifying is a great way to do that. It's also, I think, contributing to the profession of public health, increasing recognition of the profession. So many of our sister professions have certifications: nursing, social work, health education, medicine, law, nutrition. So why not us? As you'll hear, to maintain your certification, you need to complete at least 50 continuing education credits every 2 years. And recertification is really easy. You can earn credits for many activities that you would probably be doing anyway, like going to conferences, attending webinars. Basically, you can get credit for any kind of professional development and continuing education that's outside of your job. So I've been able to maintain my accreditation, my certification, just by my normal professional activities. And I think for all these reasons, I would encourage you to become certified. And as I said, I have to jump off now, but I'll be happy to answer any questions that you may have and support you in any way.
Thank you so much, Dr. Klitzman. We appreciate you spending some time with us this afternoon.
Of course.
We'll provide that contact information to all who are here and who have registered to watch this recording. And with that, I'm very pleased to introduce Allison Foster, who will be our lead speaker for the remainder of this event and who will introduce Lesnar shortly to speak about his experiences as well.
All right, that's great. I feel like half of my work's been done. That was a really nice overview, and it was not rehearsed. so Dr. Klitzman captured all the salient points here. So hi, I'm Allison Foster. I'm the president of the National Board of Public Health Examiners, and I'm very happy to be here with you today. So what we're going to do is we're going to talk to you about why certification in public health is important. I love the fact that when you all registered, you were asked for a question for the presenter, and there was a theme, and clearly you want to hear more about why. So I'm going to spend a bit of time on that, and my friend Lesnar is going to jump in, and he's also going to tell you his story. Then we're going to turn to the actual certification process, including the exam. I know that's where a lot of folks get nervous or worry about. So we'll talk about what it's like to take the exam, some tips on preparing, spend a little time on study resources, and then we'll just wrap up right at the end on recertification, because we want you to know if you get certified what you'll have to do to maintain that certification. All right, and I'm going to kind of go a little bit fast. I have a lot to say. I love the certification and I love the CPH, and I'd go too long if you let me, so I'm going to try to move a little fast. But I've got the chat open, so if any of you want more information or you've got questions, go ahead and I'll either slow down or we'll pick them up at the end. All right, so first, the NBPHE is the organization that offers the Certified in Public Health credential. It's the National Board of Public Health Examiners. We've been around for about 15 years. Our board of directors is comprised of representatives from all these organizations. So you can see there's health departments, accreditation, academia, etc. And we also have at-large CPH members on our board as well. So we really represent the whole gamut of public health. So I love milestones. I love celebrating. Like I said, we've been testing for 15 years. So we're going to have a little birthday party in August when we hit that mile mark. To date, we've had about 12,000 examinees. We have had candidates test who are in or from about 95 different countries. So this is not an exam just for the United States. It actually applies to any public health professional around the world. And currently, and I'll touch on this, not spend a whole lot of time, but we do have 11 schools and programs that require their graduating students to take the CPH exam. So let's talk about why certification. Why is this important to a public health professional? So to talk about that, we kind of have to go way, way back to as early as 1980. This is a conversation that the public health field has been having for a very long time. And I don't need to tell you all that public health sometimes does not get the attention that it needs. Is that a lot of times folks think of the clinical professions, when it comes to how to solve a health problem. Public health has been fighting for years to get a seat at the table and to have the same recognition as other health professions. And it's also not as well funded as it should be. So the thought has been that we really need to professionalize the field so that the public, meaning anybody who benefits from public health, has a really clear understanding of the importance of public health and is willing to put the resources into it to make it work as well as it can. So since 1980, there have been discussions specifically about why certification in public health. So it does make the field more broadly recognized when people have a similar credential, and we'll talk a little more about different reasons. But this conversation has been happening for years and years. CDC has had calls for certification in public health. APHA has had calls for it. The U.S. Surgeon General's office has made announcements over time. But as you can understand, sometimes conversations go on and on and on and nothing happens. Finally, in 2005, two organizations, the Association of Schools of Public Health and the American Public Health Association, got together and said, let's build this, let's do it, enough talk. So they created the National Board of Public Health Examiners in 2005. The original board got very busy, built the first exam, and the first examinations were given in 2008. And here we are, 15 years later, certifying public health professionals. So why were these calls for certification in public health? So there's sort of a thought out there for what defines a profession is basically a three-legged stool. So, and in the next slide, I'm going to show you a couple examples, but most professions have these three components. At the top is accreditation. So accreditation is an approval process for institutions. You as a person cannot be accredited. It's always a program, an institution, an organization. So we've had that for a while. We've got CPH accreditation of schools. We've got FAB accreditation for health departments. Then going to the right, we've had degrees in public health, actually for probably 100 years. There are, the NBPHE, RPH, other degrees in public health, but what we have not had is individual licensure certification. They're fairly similar. We're talking about certification here, but that is the process that assures an individual is competent to work in a field. So you certify individuals, you accredit institutions. So we've not had that in public health. And I think we've really been missing an opportunity so that everybody working in public health, no matter what their degree is, no matter their work experience, their title, their organization, we're all unified by a similar certification. So here are a couple of examples of other professions that have certification. I could have a very long slide with probably, I think there's something like 7,000 certifications in the United States alone. So we could show you a lot of those, but these three examples I think are pretty good ones. So I also want to mention that we do get the question, well, if I have a degree in public health, why do I need a certification? But in so many other professions, you need to have both. They measure different things. So degrees measure that you finished a course of courses, an entire curricula, and there was some kind of an assessment, and that you have obtained a body of knowledge. A certification, on the other hand, assures that you are competent to work in a field by a national standardized assessment, meaning it's not offered by an individual organization. It's standardized across the profession. And once you earn that certification, you have to keep going. Your certification can be revoked, but you also have to maintain it through recertification. So the two things work really, really nicely together because they do measure different things. So the example that I like to give, just because I think everybody's really familiar with it, is a CPA and accountant. So probably if any of you have your taxes done, you've asked the CPA to look before you file. That CPA does have an accounting degree almost always, and they also have sat for the CPH exam, which is a process very similar to ours. So those two things do provide a holistic assurance of their competency in the field. Okay, so there's lots of reasons why this is important to public health. But I know that you all are also wondering, but what about me? Why should I get certified? I mean, since 2008, we have had quite a few people be certified because they think it's the right thing for the field. But most people also want to know how they're personally going to benefit. So what I typically do here is I have a video, and I know you all are going to get a link to it after the webinar. We brought CPHs into our office, asked them just to tell their story, why they got certified. The video is on our website. You're going to get a link to it. And I really encourage you to take a look later, because I think it might sort of trigger some, similarities. You might think, I get what they're saying, and that really motivates me. However, we have something better today. I'm going to ask Lesnar to tell you his CPH journey and why did he get certified in public health.
Thank you so much, Allison, and good afternoon, everyone. And the reason why I decided to get certified, because it was brought up to my attention by one of my colleagues who also attended SPH. she told me that getting certified will help distinguish me from other people in the field, especially when it comes to hunting for jobs or getting salary increases or positions of leadership. And as you know, the pandemic just happened. So I had more free time to study. So I decided to do it. And upon passing the exam, I have noticed different opportunities of leadership roles in different organizations being offered to me. And I'm glad that I did it. And I would, I'm happy that she told me to do it. And I encourage everybody to try to pass the exam. It is difficult, but if you study, it's doable.
All right, fantastic. All right, thank you. Okay, so I'm just going to kind of pause on that thought for a moment. So that is another question that we get is, do employers require the CPH? And what we're finding is more and more, there are many more employers are requiring the CPH, and partly because we were kind of the new kid on the block for a while. And employers typically aren't going to require a certification if they don't have many candidates to choose from. But now we've been around for 15 years. There are plenty of CPHs out there, and we're really starting to see a difference. Particularly, the interesting one is the health departments, I feel like, are coming out of the woodwork right now. And I'm doing webinars every week, review sessions, getting health department employees certified, but other organizations as well. And I think it's just because we've been around for a while, and now we're sort of a known way to hire and retain staff who are prepared to do their jobs. So I can't tell you for any individual job, will the CPH help you to get that job or will be required? I don't know. There's so many employers out there. So I thought instead I'd show you a little data that was collected by Gallup Strata. They did a survey, and what they found is that employers value certifications in general. Doesn't matter what the certification is. They know what certifications mean, and they basically mean that you had the wherewithal to sit for a standardized national exam, which was the subject matter was determined by a body of subject matter experts, that you have a commitment to the field, otherwise you wouldn't have gone to all the trouble to pass that exam, and that you're committed to the field by maintaining your certification through recertification. And these are all really good things. Employers know if you have a certification, it means you know your stuff. So I would say, by and large, even if you apply for a job and this employer doesn't know what the CPH is per se, they're going to know it's a certification, starts with a C, and are going to probably value the fact that you do have a certification. But hopefully more and more know it by name as well. And here we do partner with ASPPH because we just want to know which employers. So it's fun to look at trends. And so they have a website called publichealthjobs.org. And so in that case, the employer can tag jobs as requiring or preferring the CPH. And this is just an example of some of the types of employers that have posted a job there that required or preferred the CPH. So you can see it's a mix of health departments and private organizations, academia, and as I mentioned, it's the health department's really interesting, but we've had Carnival Cruise Line, we've had a lot of interesting organizations post jobs, so it is trending up for sure. All right, so I'm going to go through the process of getting certified. So most certifications, it's the exact same process. We actually have accreditation standards, so we can't mix it up too much. The eligibility is your first step is we have to make sure you're eligible, because we don't want people walking in the door and failing the exam. We want to make sure you have enough education experience that you can pass the exam. And having the certification also means that you're a public health professional. So it's important that you have something behind you, whether it's work experience or academic experience to say you're a public health professional. Then you do need to pass the exam. I'm going to go into that in just a bit. And then you do need to maintain your exam through recertification. And I see the question, I'm just going to back up about, do employers value the CPH and CHES similarly? And I might as well just stop here and answer that one. So there's a lot of similarities between the CPH and CHES. We build our exams, we manage our processes pretty similarly, partly because of the fact that we're, in the world where certifications are pretty standardized, the way that we have to manage our processes. I'd say the big difference between the CPH and CHES is focused on health education. There are other elements of public health in their exam, but it's really for health education specialists. So if you're a health education specialist or that's the world you want to go into, yes, get your CHES. That's probably going to take you further because that's what's going to be recognized in the health education world. But if you're not sure where you want to work, where you're going to end up, CPH might make more sense because we do cover the entire span of public health. So we're not focused on one specific area. Or I'll just throw it out there, you can get both. We have had plenty of people, as long as they were studying, they might as well study for both. And we have lots of people who have CPH and CHES. All right, so eligibility. So I just mentioned you do have to be eligible. I assume you all are either students or alumni of CUNY School of Public Health. If that's the case, you're all eligible. Or will be soon. So our criteria for students and alumni is if you've graduated from a CPH credit school, then you are eligible. If you're a student right now, it's really up to your school to decide. Again, we don't want people walking in and taking the exam when they're not ready. So the schools all determine when students can take the exam. Maybe it's after taking your core. Maybe it's after your first year. I don't know. It depends on your curriculum, the courses you've taken, and the policy of the school. But at some point, your school will say, okay, you're good. You can take the exam. So honestly, that's a conversation you need to have with your school, what their criteria is if you're itching to take the exam soon. We do also have other eligibility for individuals who do not have a CPH accredited school degree. As you know, most of the workforce doesn't have a formal education in public health, so we do have other criteria, but my bet is if you're on this webinar, you're probably would apply through alumni or student criteria. All right, so once you've determined that you're ready, you want to get started, you will apply to take the exam. It's a really simple application, doesn't take much time at all. I would say go ahead and register yourself, at least create an account, because if we have updates, and we will, periodically we change some of the content on our exam or we change a policy, we want to be able to tell you. And if you're not in our system, it's very hard to let folks know. So at least create an account. And then once in a while, you'll get a message from us with updates. And we might send out a "Are you still there?" message that our system will, but don't worry about it. You can keep that account open as long as you want. So when you're ready to start applying, so you go to the Get Certified tab on our upper left of our website and click on Apply Now, fill out the application. So then your school will actually get a message that says that you're interested in taking the exam. And as soon as they can verify that you're eligible, then they will verify your eligibility. They use a little portal, so it's usually a pretty quick process. Once your eligibility is verified, should be within about 2 weeks. Once you're verified, you will get a message from us saying, congratulations, you've been verified. Keep an eye out for a message from our testing vendor, and then our testing vendor, Measure Learning, will send you instructions how to schedule your exam. So when that happens, you can schedule right away. That's fine. There's no waiting period, or you can wait as long as you want. We've had people wait for 2 years to take the exam because they decided they want to take courses or life just got busy. Right now, our policy is we don't time anybody out. There's no deadline. Once you're eligible, you're always eligible. So don't worry about it. If you decide, I want to study some more, I just started a new job, I'm not ready, it's fine. You can sit and wait in our system as long as you want. So when you do apply, you do need to pay the exam fee. It's an application exam fee, all rolled into one. Our starting price is $385, but we do have a partnership with your school. So when you apply, if you indicate you're an alumni or student at CUNY, then your price will actually adjust by $70. So it'll just be $315. So you can thank your school for negotiating that discount for you all. And I mentioned there are 11 schools and programs that require the exam. Not going to spend any time on that, just in the interest of time. So when you do decide you're ready to schedule, you can take the exam any day of the year. We offer the exam 365 days a year. So no windows. So whatever day is good for you is good for us. All right. So we give the exam 2 different ways, by computer-based testing center and live online proctor. We added live online proctor about 3 years ago. Thank goodness we were ready when the pandemic hit. It's completely up to you. Does not matter at all to us how you choose to take the exam. So if you go to a computer-based testing center, we have about 1,400 testing centers. We have a place where you can search and figure out locations. You walk in, there's somebody to actually help you. They sit you at a computer and will offer any assistance if you need it. But what we're finding now is about 60% of our candidates take the exam by live online proctor, just because they don't have to go to a testing center. You do need to have a computer, like a laptop or a tower, I suppose. You can't take it on an iPad or a phone. You have to have a private room, and you do have to have a mic and camera. But we see it's a pretty seamless way to take the exam. So Lester, why don't you, if you want to mention, you took your exam at Computer-Based Testing Center. Do you want to tell everybody what that was like?
Yes. When I went to the computer testing center, I took it in November, and I went to a location in Queens. And when I went, I had to bring my ID. They told me to put all my possessions inside of a locker, and they put me in a room with one extra person, but that person was taking a different exam. And I stood at the computer and I was able to take it. I was nervous though when I took it because I didn't know what they was going to ask, but they gave me like about 2 hours to complete the exam, 2.5 hours. I was able to finish it in a little over an hour, but that's really what's the process. So they made sure you have your phones in the locker, you got to bring ID, and that's about it.
Yep. And we have a candidate handbook when it's on our website, but when you also schedule, you'll get a link to it, and it kind of walks you through all the things. So hopefully you don't forget. But it's pretty simple process. So one thing we also changed a couple of years ago is we've instant scoring. So now when you submit your exam results, you know right then if you passed or failed. And by the next day, our system updates overnight. By the next day, you can log in and see your scores for each domain if you're curious how you did across the domains. Okay, so the exam itself, we give you a 4-hour window to answer 200 multiple choice questions. But what's really interesting, we know people worry about taking a standardized exam, get nervous, are they going to run out of time? So we just looked at the statistics for the last 2 years. And as you can see, the average candidate took 2 hours and 50 minutes to take the exam, which means they had an extra hour. So they had plenty of time to go back and review their answers and take their time answering their answers. And we found very, very, very few people that actually maxed out the time. So it's exceedingly rare. But we also offer additional time for individuals who need more time for medical accommodations. So I would say I can feel pretty confident saying you'll have enough time to answer the questions as quickly or as not quickly as you need to. So if you're tend to take more time on the exam, 4 hours should be plenty. So if you're applied there as an alumni or a student, it is important to know that yes, your school, select individuals at your school will see your scores. And we do this because the data schools get on how aggregately the alumni and students do on the exam is incredibly important, because it allows them to see how well they are teaching the curricula compared to other schools and programs. So your scores are only seen by a few individuals at your school, and the other schools and programs cannot see your scores. So please don't worry about that. But it allows your school to roll everything up and see how are they teaching the areas, and are they overperforming or underperforming other schools and programs. And I'm sure you understand that's the kind of data that it would be nearly impossible to get any other way. So passing rate, so you can see here, this is the number of people who have taken the exam. This is not the passing score. You do not need to get an 88% on the exam to pass. This is how many people pass the exam. So as you can see, it started in the beginning about an 80% average, and over time it's increased to about 85. Last year, our passing rate, see, I did it, was 88%. So 88% of people who take the exam pass on the first pass. So I hope that makes you feel a little better, is that you've got a pretty good shot as long as you're as prepared as the average person. So once you pass the exam, then you will be added to a registry. And then as long as you're active CPH, then anybody can look you up. And we do this for employers because they like to verify the CPH. But if you fail, if you lapse, et cetera, you won't show up on our website. It's only if you're active and passed. And we will mail you a certificate that you can hang on your wall and show off your CPH a little bit. And we'll also send you a customized URL to a digital certificate. And it's kind of cool because you can add it to your LinkedIn profile or email signature or whatnot. And then folks can click on it and then they can scroll down and see more about the CPH. So it's great for employers that haven't heard of it before. If you take the retake the exam, because you don't pass the first time, then there's no waiting period. All you do is pay $150 retake fee, go right in, schedule right away, or not, you can wait, but we don't have a waiting period. And we also don't have a limit on how many times you can take the exam. And part of the reason why we don't have a limit is because we have multiple versions of the exam being administered at any time. So if you take it once and then you take it a few months later another time, it'll be a completely different set of questions. So we're not worried about it for security reasons. So now we're going to talk a little bit about what's on the exam. And I'm going to ask Lesnar to jump in just a minute. So this is what we call our content outline. This is what most certification bodies call the map of what's on their exam. So the way I'm going to show you a different view of that in a second, but the way we determine what's on our exam is we do something called a job task analysis every 5 to 7 years. And it's a really detailed survey where we ask members of the profession, basically, what do they do on a day-to-day basis? What is important? What do they do frequently? What is critical to their job? So we're asking, what are they currently doing? Remember, we are assessing that individuals are competent to work in public health now. So we need to test people on what the most common and important tasks in public health. So we just did another job task analysis. So at some point, I don't know, maybe sometime by next year or the year after, we are going to update our content outline a bit, but we will make plenty of announcements. We're ready to do that. So the content in our exam does change over time because public health changes over time. So this is a better visual of what's on our exam. So these are the domains. I think of them like chapters in a book or buckets. Within each domain, we have lots of individual tasks that are very specific. And I'll show you some examples in a moment. But you can see we cover the whole area of public health. It's a certification for the entire field. Therefore, we have to pretty much canvas the whole field of public health on the CPH exam. I think, Lester, I'm going to ask you to say a few words after this one, but I did want to point out when I showed the previous slide that you might have seen a couple domains and thought, I don't know a whole lot about that one. And you might have a few domains where you're quite worried. So I'm not saying it doesn't matter if you're not strong in all the domains, but our passing score is overall, and that means you can do worse on a domain. You can do really quite not well on a domain as long as you do well enough in the others. So we just total up your scores and that's your passing score. There is no scoring per domain for passing purposes. The other thing I want to mention is if you take the exam, there's no penalty for guessing. So if you have a question and you just have no idea what the answer is, just guess. We don't give you a penalty for answering wrong. We just total up all the right scores. So if you have a question and you don't know the answer, you have a 25% chance of getting it right. So make sure you answer every question on the exam instead of just walking away from any of them. So Lester, I think if you don't mind, could you talk a little bit about, you mentioned this a bit earlier, but how did you find what was on the exam? How was it harder than you thought? Was it easier than you thought? And where were you have any tips for folks who are worried about the breadth of the exam?
Well, when I first heard about the exam, I thought it was going to be pretty straightforward, but when I took my first few practice tests, I realized that it was harder than what I anticipated because there's so many different topics that are covered, and a lot of it were not in my particular field because I was environmental occupational health. So learning things such as the laws and the ethics and other domains were a little difficult. So I ordered the practice book, the exam book from the website to read up on it, brush up on those things, and took practice questions on those subjects to strengthen me for the exam. But the exam, it's not there to trick you, but you should have like a pretty wide knowledge based on all the domains and answer the best questions available.
All right, great. Yeah, that's pretty typical of what we heard. We actually did a survey where we asked about, was it harder than you thought or easier than you thought? Many people said it was easier. A fair amount said it was about right, but there was a pretty solid amount of people also said it was harder than they thought. But keep in mind, again, the slide I showed earlier, that 88% of people passed. So it feels hard when you're taking it, but most people end up passing. So, okay. All right. So what I'm going to talk about now is study resources, because I'm sure if you're thinking about taking the exam, you want to be successful. So we make a number of study resources available. So I'm going to run through those. But first, we've been doing a lot of surveys lately. So we did a survey and asked folks how long did they prepare to take the exam, and we didn't know what results we were going to get in the survey, and it was really interesting what popped out. And it looks like most people said they took it probably an intensive, but about 3 months. And we have 10 domains, and that kind of tells me there's probably, and I've also heard this anecdotally, people break it down and take like a domain a week to prepare, and so the 3 months kind of makes sense. And you can see there few people took over a year, and then some people didn't prepare. So I don't know if they were successful or not. I couldn't see that in the survey results. And then how many hours? So this also, I think, makes sense. It looks like if you really break it down, about 3 hours per week and cover all 10 domains. That's my takeaway, but it of course varies depending on individual response. So if you go to our website, click on Get Certified, there's a page called Study Resources, and this is everything that we know of. I do want to mention that many of you are taking classes right now. That's helping you prepare. There are, some of you might have work experience. That helped you prepare. So our study resources are a piece of what you can do to prepare, but your life and academic experience is also going to help you. And you might have other resources as well. So on our website, I'm going to run through these. So this is what we suggest you do to prepare for the exam. First start with looking at our content outline. Just remember the wheel that I showed you. This is what it actually looks like broken down. Just scan it the first time. You don't need to run everything through the yellow marker or something. Just scan it. And what you're going to find is there's some domains where you think, I do that. That's my job. You're probably pretty good in that domain. You're going to see some domains where you think, I don't even know what they're talking about. And I don't remember taking a class in that, etc. That's probably where you need to study. So I would use this as a very high level way to build a map of where you need to focus your efforts in studying. We do have a couple sample questions posted on our exam, and the purpose of these is so you can see how we write questions. It's not to cover the content. There's only, I think, 10. But you can see how complex is the wording and how long are our answer options, et cetera. And you can just take a quick look at that. It's like a little tiny peek behind the curtain of the CPH exam. But where I do suggest you spend a little more time is we now have 2 practice exams. They're 50 questions each. I would take one early in your studying and assess how, did you do? I would study for a while and then go back and take another practice exam. They're free. You can take them as much as you want. But if you want to kind of measure your progress, this is probably a good way to do it. So the results, when you take the mini exams, it gives you by domain 3 assessments. You either were, it says probable strength, and that means you did really well in that domain. It'll say satisfactory, and that means you did well enough. You don't need to get probable strengths and everything. Satisfactory is good enough. Their other assessment is possible weaknesses. If you get a lot of weaknesses, possible weaknesses, I'd say I don't know, 3, 4 more domains, that means you really do need to study. So use the assessment results as a rule of thumb when determining how much more studying do you need to do. Oh, I forgot I added this slide. So this is exactly what it looks like when you're taking the practice exams, and then those are the assessments that you'll get when you're finished. All right, so once you kind of have an idea, okay, these are the 3, 4 domains where I really need to focus. We do have some other resources available. One is ASPPH a couple of years ago had faculty record webinars in each of the domains. And so we get really good ratings. Like, people love these webinars. So I do suggest you take a look at them. They're obviously free, available whenever you want to. They're typically lecture first and then Q&A at the end. So you can go explore those. Then we have 3 study guides that are all produced by different organizations. They're not our study guides. And the only reason I'm mentioning that specifically is because if you notice a question that doesn't look, you don't agree with the answer, please keep in mind they're not real questions out of our exam. They're questions that were developed by the organizations offering the study guide. So don't worry too much if you see that. So ASPPH has launched the first study guide. It's an online only, and it's very heavy in practice questions. But what's kind of fun is when you take the practice exams in that study guide, you get a video pops up for many of the questions, and somebody is actually talking to you about why their answer is right or wrong. Then APHA put together a study guide maybe 5 years ago. No, it wasn't even that long, maybe 4 years ago. This is a really nice complement because it's a sort of a textbook format. And so if you feel like you don't know a lot about an area, it actually has a chapter for each of the domains plus some practice questions. So it's a nice complement to the ASPPH study guide. And then lastly, Springer Publisher put together a study guide a couple of years ago. This was the latest one. Lots and lots of practice questions. But if that's where you're just worried about taking multiple choice exams, then this one might be helpful as well. All right, and then the last is we're doing lots and lots of review sessions right now. So typically our review sessions are an organization comes to us and says, will you host one? I'm trying to get all my employees certified, or et cetera. So we have a couple that we're working on right now. We're going to have one that's open to the public in San Diego in June. I know that probably won't do a lot of you any good. But if you happen to be in the Southern California area, then if you go to our website, you can sign up to participate in that one. We're doing an online one for the DC Health Department right now. And we're also planning another one in May for the Commission Officer Association. So our hope, I'm sorry, and the one we started with years ago is we also do Learning Institute for APHA. It's usually the Saturday and Sunday before the APHA annual meeting. We will have it this year. We don't think the registration is opened yet, but if you're interested in participating in that one, just keep an eye on our website. And our goal is to start hosting standalones throughout the summer. So do keep an eye on our study resources page for exam review courses. So I'm going to pause there and see if Lesnar wants to jump in any additional study tips that I should have mentioned.
Yes, I agree with the PowerPoints, the presentations. Those were extremely helpful for me, especially in the domains that I did not know. Like, they had some on epi, law. And so watching those, and you can watch them at your own pace, and you can use the Q&A and then go practice some questions on those topics, and that will help strengthen you. So that for sure, that's what really helped me pass.
All right, great. Okay, so I'm going to go a little bit quickly on this part, but I do want you to know what's coming up after you get your certification. So every certification has a recertification process. The way ours works is you have to report 50 recertification credits every 2 years. There is $95 fee every 2 years, and we do have a online module to make it really convenient to report your credits. So our recertification takes into account that public health professionals work in so many different types of jobs and have access to different types of resources. So as Dr. Klitzman mentioned at the beginning, is for the most part, we allow for many types of activities. So for the most part, as long as it's not your day-to-day job, and you're doing something to continue your education, lifelong learning, your activities should count. So we have a very detailed list on our website. This is kind of like a summary of the types of activity counts, but we don't require you to go to a conference. We don't require you to, pay lots of money to stay certified. Many of the activities that we allow for are free. And I love the flexibility because it also gives us a glimpse into what public health professionals are doing professionally. For example, our criteria for volunteer and leadership service. I mean, this is so important to public health, and we just love seeing what people submit and the volunteer activities that they report back to us. The other difference with our recertification process is that we do not have pre-approved providers. We do not think that we should be telling you where you should earn your credits for recertification. So you can go to any organization as long as it meets our guidelines of what type of activity and it's related to public health. But it is up to you to decide who you want to participate on a webinar with, or which other types of activities. It does not matter to us who the organization is. So as I mentioned, we've got a portal that makes it really easy. And then occasionally folks get a little stuck. They're coming up on the end of their deadline and they think, oh no, I need to earn 10 different credits. I need an idea. And so we do partner with 3 different organizations that manage databases of recertification credits, but these are just suggestions. You can do a Google search and find what you need. You can ask colleagues. You can go out into the CPH community and ask for suggestions, but we do have these databases as a good way to find credits. And then I'm going to kind of wrap it up here. So if you do get your certification, be proud. That's an amazing achievement. I mean, you're part of the professionalization of public health. So you're welcome to go to our Cafe Press site and, buy that coffee mug. And listener, I hope you got one on your desk at work and people come up and say, what's that? And you can say, let me tell you about the CPH. We also, once you're certified, have a really fantastic book club. It's been going on for about 3 or 4 years. We read about 6 books a year and just fantastic. We have, I think, 1,300 members of our book club now. So you'd be invited to join that. And then building a community for CPHs is incredibly important to us. So you'd also be invited to join our LinkedIn group where you can network with CPHs all over the country and all over the world. All right, so I'm going to stop there. I'm going to stay here just for a moment. If you do have questions, we love to hear from you. Just email us at info@nbphe.org and we'd be happy to answer any other questions you have. All right, now I am going to stop sharing and see if you all have additional questions.
Thanks so much, Allison. Does anyone have any burning questions they'd like to start with? I know I have one, but I want to see who in the room might want to kick us off. Well, while you are thinking, I wanted to see if you could say a little bit more about the APHA. It wasn't exact, I forget the exact language you used, not study group, but the prior to the annual meeting, the
Learning
Institute. The Learning Institute. So for those in the room who are I would imagine everyone here is an SPH alumni or a current student. If you do not know, CUNY SPH provides free membership for our students to APHA. So this might be a fantastic opportunity for those of you who are students or recent alumni, because depending on how long you took to get your degree, your membership as a student may actually stay active for 1, maybe even 2 years following your graduation date. So I wanted to flag that, Allison, as an opportunity that might both help our students to connect to APHA as members and also to benefit from that knowledge for this exam.
Yep. So yeah, so APHA calls them learning institutes. That's why it's called that. So what we do is usually Saturday morning, folks can register for this since it starts Saturday morning before APHA, and we bring in faculty who spend, I don't know, maybe 90 minutes across all the domains through all day Saturday until Sunday morning. And they give a bit of a lecture, and then they also spend lots of time with Q&A. So if you're just not feel like you're not getting it, or you need them to work through some practice questions with you, then you've got their undivided attention. So that's a format that we're going to be using in other certifications or review sessions as well. So like I said, I don't think APHA's launched the registration for that, but it'll probably be up by June. That's usually when they open up all the registrations. So what I'd suggest is if you go ahead and create an account in our system, and then we'll probably let everybody know when that's open as soon as we have an active link for you.
Great, thank you. Oh, we've got a chat question hi, Gordon. For epidemiologists and biostatisticians, what are a few examples that they complete for CPH recertifications?
I can go back. So I think we have 500,000 activities reported in our database, and I have to look. So you can always email me and I can look it up. But what's really interesting is we did a scatter plot a couple years ago by people's area of specialty and the topics that they did the recertification credits in. And there was very little correlation. And I found it interesting. And I don't know because they weren't currently working in that area, or that's the point. Maybe they know so much about their area, they wanted to branch out a bit. But we can certainly look for you if you email me and look at recertification activities that have been reported that are related to epi and biostatistics. So Gordon, you've got our email. So just info@nbphe.org, and just remind me and we can look it up for you.
All right, thank you so much. We have a few minutes if there are any final questions, or Tina, if there was anything that you flagged that you'd like to ask, and then we will close out.
And I think it's just a reminder of the support that's given through the school. And at CUNY SPH, there is a $70 discount that for available to students and alumni to take the exam. So definitely encourage folks to look at that, and the support through the school, but also through the community, for Lesnar being here to share his story. Now, is everybody ready to sign up for the exam? And just the ongoing support too, if for those that current students, I'm here to meet with you on career coaching, so feel free to schedule an appointment, and we can have a further chat and in looking at these professional activities or ways that you can build your portfolio and strengthen your yourself as you move forward in your career journey.
Great. Wonderful. Thank you all. I just did place a link in the chat to the CPH exam page on our website, which links to the CPH and NBPHE webpage. And then Tina will be following up to all who registered with all of the email contacts, resources, and links that we were talking about here today. So I just want to thank again Allison Foster and Lesnar Guerrier for their time with us this afternoon. This was incredibly informative. I'm also going to be planning to take the CPH exam. So if anybody here is interested to, connect about that, I'd be more than happy to talk to you as well. So please reach out anytime to any of us as is needed. And we look forward to seeing you again soon.
Thank you so much.
Thank you.
Thank you. Thank you for joining us at work, Glory.
Thank you. So I'm actually a public health advisor working for the New York City Department of Health and Hygiene. So I'm just trying to heighten my skills with the certification. So I'm hoping that, I know I'm in a good place right now.
Yeah, absolutely. And it sounded too from what Allison was saying that especially in the health departments, this is really gaining traction and helping leadership there to identify
Yes,
candidates for positions of of higher leadership and qualifications. So if there's anything we can do to help you as you're moving through that path, please let us know.
yes, just I know that I had to do some physical, so I wasn't able to, stay online. Just continue to email me. And when I do get that time, I'm gonna reach out. And also about the APHA,
Mhm.
just send me all of the information as well as the other participants.
Absolutely. Yeah, we'll include APHA membership in the email follow-up for sure.
Yes, yes, I thank you so much.
Absolutely. All right, everyone. Take care. Thank you.
Bye-bye.
Have a wonderful day, everybody.
You too. Thanks again, Lesnar.